Hello everyone. Today we shall be discussing about semaglutide, an incretin-based GLP-1 receptor agonist which is going to bombard the market in March 2026 as the patent of semaglutide is going to be done by March 2026. You'll see n number of brands coming up with semaglutide and before choosing to start on semaglutide, it is worthwhile to know about the indications, who needs to take it, who should not take it, what are the benefits, what are the side effects, and what are the absolute contraindications. And people with heart failure, can they take it? People with cardiac disease, can they take it? People with kidney disease, can they take it? People with retinopathy, can they use it? So, today we shall be discussing in detail about all these scenarios, including the mechanism of action of this semaglutide. Stay tuned till the end. Let's start the discussion. And by the way, quick learners can listen to the video in a faster speed, either 1.5 or 2, whichever is comfortable to you. Thank you. So, semaglutide. Semaglutide is part of the incretin analogs. It is a GLP-1 receptor agonist. Usually GLP-1 normally produced from L cells of distal ileum and colon. This GLP-1 is metabolized by DPP4. So you can have a doubt. We are giving GLP-1 receptor agonist semaglutide. Will that won't be metabolized by DPP4? Semaglutide is designed in such a way that there is a small amino acid tweak so that DPP4 cannot metabolize semaglutide. So semaglutide as a result of this can have sustained effect, and with small addition of a fatty acid carbon chain you can have prolonged effect of this semaglutide for approximately 1 week. So how is this semaglutide useful? It acts on the beta cells of pancreas to increase insulin. It acts on the alpha cells of pancreas to decrease glucagon when sugars are high. It acts on the central nervous system at nucleus tractus solitarius, area postrema, and arcuate nucleus, where the appetite is suppressed and the hunger is decreased. The food seeking behavior as a result comes down. So, this area postrema is also important because as the GLP-1 receptors are present in this area postrema, this when this semaglutide goes and acts on the GLP-1 receptors in area postrema, it can lead to nausea. Nausea. And then It acts at the GI to decrease gastric emptying. It acts at fat to increase lipolysis secondary to weight loss. These are the predominant effects of semaglutide, where there is increased insulin from beta cells of pancreas, decreased glucagon when the sugars are high from the alpha cells of pancreas. In the central nervous system, it acts at the arcuate nucleus in the hypothalamus, the nucleus tractus solitarius, and the area postrema to bring the appetite down. And in the GI, it decreases the gastric emptying so that you don't feel like eating frequently. And then in the fat, it increases lipolysis, which happens secondary to weight loss. In the heart, it decreases inflammation, causes relaxation of the myocardium, and also decreases the oxidative injury. Relaxes myocardium, decreases inflammation, and decreases oxidative injury. So as a result, there is reduction in major adverse cardiovascular events. And with respect to kidney, there is decrease in glomerular perfusion pressure and decrease in albuminuria. So semaglutide can also decrease the adverse events in CKD patients. So in summary, semaglutide increases insulin, decreases glucagon, decreases appetite, decreases gastric emptying, kidney protective by decreasing glomerular perfusion pressure and decreasing albuminuria. And in the heart, it decreases the major adverse events. And in the fat, it leads to lipolysis, which is secondary to weight loss. And coming to the indications, semaglutide can be used in patients with BMI more than or equal to 30 and BMI more than or equal to 27 plus comorbidities like diabetes, hypertension, etc. Semaglutide is currently available in three preparations: sema oral, subcutaneous for obesity, and subcutaneous for diabetes. The brand names, as I cannot mention, you can go through them in the web. There are three preparations of semaglutide currently: the oral preparation, the subcutaneous preparation for obesity, and subcutaneous preparation for type 2 DM. Oral is daily, once taken in fasting with glass of water, and you should not take any other medicine or food for at least half an hour. Gap of half an hour. And then you have semaglutide for obesity, which is given subcutaneous once a week. And then you have semaglutide for type 2 diabetes. This is also given once a week subcutaneous. The dosages for oral semaglutide are 3 mg, 7 mg, 14 mg. Oral semaglutide is approved in the doses of 3 mg, 7 mg, 14 mg. Higher doses are currently under trials. And then subcutaneous semaglutide for obesity, the approved doses are 0.25 mg per week, 0.5, 1, 1.7, and 2.4. This is the maximum dose. So, subcutaneous semaglutide for obesity, the dosages are 0.25, 0.5, 1, 1.7, and 2.4. These are weekly injections and the dose escalation to be done every 4 weeks. For example, you're starting a patient on 0.25 per week, you give it for 4 weeks, you assess the patient, and then you start on 0.5 that you give for 4 weeks, and then 1, and then 1.7, and then 2.4. 2.4 is a maintenance dose. And then for diabetes, we start with 0.25 mg per week, and then we give 0.5, 1, and 2. This is the dosing titration schedule for diabetes. Semaglutide is given once a week, starting with 0.25 once a week for 4 weeks, and then 0.5 for 4 weeks, 1 mg for 4 weeks, and then 2 mg is the standard maintenance dose. So, what is the minimum duration of treatment and the maximum duration of treatment? This many patients come to us and ask the same question, sir. How, what is the minimum duration for which I need to take semaglutide, and what is the maximum duration? Minimum duration is minimum we need to at least give it for 12 to 16 weeks to see desirable results, and maximum it is to be given lifelong. What if we stop? So, one common doubt patients ask us is, sir, if I stop semaglutide, what is the chance of me gaining the weight? Obviously, when the drug is being withdrawn, the chances of putting on weight is high. Usually, you gain at least two-thirds of the lost weight in about 1 year. But always remember, when you start losing weight, you get the confidence, you feel good, and you want to maintain that. Despite not being on drug, your willpower can support you. Remember, weight loss is always about discipline more than any drug. When the food intake, the exercise, your lifestyle patterns are on good path, the weight loss journey is always sustainable, whether you take a drug or not. So, if your weight is abnormally high, it is better to choose GLP-1 RAs for weight loss, at least for significant period of time, if not forever, and then overlap it with additional discipline. And one more common doubt patients ask us is, if we are planning pregnancy or if we are pregnant, can we use this medicine? Pregnancy. No, you cannot use this drug during pregnancy. You need to stop sema at least 2 to 3 months before conception. So, if you're planning for pregnancy, you need to stop the medication at least 2 to 3 months before conception. The semaglutide can have some teratogenic effects. What are the contraindications for semaglutide? MTC, medullary thyroid carcinoma. If a person has MTC, or if a person has a family history of MTC, it is an absolute contraindication because rodent models have shown increased incidence of C cell tumors. It has not been shown in the humans, but rodent models has shown increased incidence of C cell tumors. So, if a person has medullary thyroid carcinoma or a family history of medullary thyroid carcinoma, it is semaglutide is contraindicated. Personal or family history. Men 2 syndrome. Men 2 syndrome. If a person has Men 2 syndrome, MTC is a component of Men 2 syndrome. So, obviously, as we discussed earlier, M- MTC is part of Men 2 syndrome. So, semaglutide is a contraindication for Men 2 syndrome as well. And then any history of pancreatitis, pregnancy, and also one more contraindication is allergic reaction to semaglutide. Semaglutide can be given in ASCVD patients, atherosclerotic cardiovascular disease patients, where there is decreased incidence of MACE, major adverse cardiovascular events with semaglutide. There is decreased incidence of adverse events in CKD, in CKD. So it is safely given in patients with ASCVD and safely given in patients with chronic kidney disease. One thing you have to remember while giving to a CKD patient is that when he has persistent nausea, vomiting, diarrhea, dehydration states, it is better to avoid semaglutide as persistent dehydration can predispose the patient to acute kidney injury. That one thing you have to keep in mind. And one of the common discussed adverse event regarding semaglutide is the retinopathy risk. Retinopathy. So before starting semaglutide, it is better to have a fundus checkup. Fundus for retinopathy. Patients who are susceptible to developing eye changes are with already having diabetic retinopathy, uncontrolled sugars, long term diabetes, etc. The eye changes are not due to the drug itself. It is not due to the semaglutide related retinal toxicity, but the eye changes are due to the rapid reduction in blood glucose control. Like how rapid reduction of blood glucose with insulin can worsen the retinopathy, the similar in the similar fashion, retinopathy can worsen with rapid reduction in blood glucose with semaglutide as well. Semaglutide has the tendency of reducing the HbA1c by 1.5 to 2%. So, rapid reduction in a predisposed individual can lead to eye changes. If before starting semaglutide, the fundus is normal, the patient can start with semaglutide. When the fundus is normal, there is no contraindication to start semaglutide, and you can go ahead and use semaglutide when the fundus is normal. So, in summary, semaglutide, GLP-1 receptor agonist, obesity doses 0.25, 0.5, 1, 1.7, 2.4, and for type 2 diabetes 0.25, 0.5, 1 and 2, and oral semaglutide 3, 7, 14. The maximum weight loss with 2.4 is approximately 15%. The risk of hypoglycemia is low. Risk of hypoglycemia is low. Decreases major adverse cardiovascular events. It decreases CKD adversities. It is contraindicated in pregnancy, medullary thyroid carcinoma, MEN2, pancreatitis, etc. It is better to check your fundus before initiating, and subcutaneous formulations are weekly, oral is daily. So, in summary, semaglutide is a GLP-1 receptor agonist, where for obesity we have the following doses, for type 2 diabetes, the following doses, and for oral therapy, following doses. And the risk of hypoglycemia is low with semaglutide. There is reduction in cardiovascular events with semaglutide, and CKD related adverse events is also less with semaglutide. Subcutaneous doses are given weekly and oral doses are given daily. Contraindications are pregnancy, medullary thyroid carcinoma, MEN2 syndrome, pancreatitis, and it is ideal to check your fundus before starting semaglutide. So, this is it for today. If you have any suggestions, please comment in the comment section. If you have any topic suggestions, also comment in the comment section. Kindly subscribe to the channel. Keep supporting us. Thank you.